Good afternoon, everybody. This is Dr. Crystal Tellier out for my walk today, and I wanted to talk to you about continuous glucose monitors, or CGM for short. Many of you have seen I ask a number of my patients to do this in practice, and as with many things, I don't ask patients to do things unless I've tried them myself. And so, what I wanted to give today were some highlights on various tips and tricks that I have used to make this a really worthwhile therapy for me, in order to just increase kind of success of what data we may want to capture from the glucose monitors. First off, need to state the glucose monitors really are technically meant for diabetics. And so the ranges that they give on the software that analyzes the data really are for diabetics. So it's always a good idea to just make sure you understand what it is that you're analyzing and what it is that you're comparing to. And while I do use this with my diabetic patients, I am also using this with patients that are just looking to optimize how they utilize the fuel that they're consuming, whether they're athletes or they know that there's diabetes in their family history, or maybe they're just noticing patterns that when they eat certain foods, they just don't feel so good. So they may not be diabetic, and therefore those ranges are not sufficient for them. Most common brand I use is the Freestyle Libre 3, but there are a variety of other brands that are out there. What I like about this one is I've got a provider portal that I can give my ID to patients, so that way I can actually analyze the data and it will import into their patient chart for me. Now, when you insert this sensor, generally speaking, we're inserting at the posterior aspect of the tricep. So my first tip is find the nice gushy spot, because the little catheter, which is a little tiny plastic piece that gets inserted in the back of the arm, needs to be placed in a spot that's not going to cause chafing or rubbing, or be in a spot that accidentally gets bumped, which happens. You run into the door or you're sleeping on it and it's rubbing funny. So find that spot that's kind of in the middle of the tricep belly, that's also kind of in the middle of the inner and outer aspect of it. And just make sure before you place it, it's not going to be rubbing on anything. The next tip is those little suckers fall off. And so the best way to help support that is to get the little waterproof, thin little tapes. They're little circular tapes that are waterproof, but also provide a little wider boundary around the sensor. And that way, if you do bump it, it's less likely to pop out, because it's a little bit of an expensive journey if you pop that sucker out before the 2-week time period for that sensor. All right. Next practical piece is I love to use these sensors to basically challenge situations. And so I tell people, yes, I want to see what it looks like on your normal day-to-day diet. And most of the time I ask people to do them for about a month. And that's often enough time to give good, crucial data. But then I also ask them to spend some time doing things that maybe are outside the normal or the ideal for their health. And so if this is somebody who drinks alcohol, I may say, hey, track some data around happy hour. And then I tell them, all right, do this. Go work out either before or after happy hour, and still have maybe that 1 or 2 beverage at happy hour, and then track your data and see, because often we'll see that glucose kind of surging doesn't happen quite as bad when we pair it with exercise. The other piece of information I ask people to really pay attention to is not just the foods that are going in their mouth, but take a peek at lifestyle aspects. Take a peek to those high pressure, high stress days that maybe you don't feel so well. Maybe there's a cold going through the house. Days that you don't get enough sleep at night. Those are all things that impact your sugars, your blood sugar that is, that sometimes even are more impactful than if you had dessert. Now, dessert. Many people like that. And the reality is there are times that we're going to celebrate. We may have a birthday that we want to have birthday cake or ice cream. And so I say, hey, see what that's like. But again, pair it with exercise, pair it with protein, healthy choices, get enough sleep, try not to overdo it, and then just watch. What does your body do with recovery when we've consumed, let's say, a piece of cake, and play with, all right, a cake by itself, but then also play with cake where you've had a good, strong protein and vegetable rich meal ahead of it. And then maybe you go for a walk and walk off some of that sugars and just see what your body does. All right, I hope those tips and tricks are helpful. Be well, everybody.